Good afternoon. My name is Lisa Teskey. I'm the Public Information Officer for Kennewick Public Hospital District and a member of this administrative team for Trios Health. Thank you for coming to our press conference today. We're going to have two statements. The first one will be by Marv Kinney, who is the President of our Board of Commissioners, followed by Craig Cudler, who is Chief Executive Officer of Trios Health. After we are done with the statements, we're going to open up to some general questions. And after that, then we are going to honor the request for one-on-one interviews. Okay, I know that you're all on deadlines. We're doing our very best. I realize it's a Friday. So what we're going to do is we're going to give you all your due time so you get what you need and you can leave here with what you need to file an accurate and timely story. So we'll do everything we can. And with that, I'll turn it over to Mark.
She already introduced me, but hello, my name is Mark Kinney. I'm President of the Kennewick Hospital District Board of Commissioners. Last night at our monthly public board meeting, the Commissioners voted unanimously to pass a resolution that the district, doing business as Trios Health, file a voluntary petition for relief under Chapter 9 with the United States Bankruptcy Court. This morning, our legal counsel filed our petition with the court's Eastern Division of Washington State. After months of restructuring and optimizing our operations, we concluded that we must reorganize our debt so that we can maintain our services for the Tri-Cities. I want to impress upon the community three things. First, that we did not arrive at this decision easily. We sought to avoid this process by working with our creditors. Unfortunately, a few are not amenable to renegotiation, so filing Chapter 9 became our best option to sustain operations. Second, that we remain confident in the current administration's effort to return Trios Health to financial health and in our employees who continue to push through this difficult time, delivering excellent care for every citizen who comes to us. Third, and perhaps most importantly, that our commitment to providing quality health care service for our community is unwavering. Trios Health will be here for its community for years to come. Thank you.
Good afternoon. I'm Craig Cutler. As Mark Kinney stated, Chapter 9 filing was not an easy decision. As a 30-plus year veteran of healthcare administration, I applaud the board for boldly taking this necessary step to give Trios Health a chance to preserve what this community deserves, a choice in care. Very recently, the closure of Walla Walla General Hospital was announced. Naturally, some people started to draw parallels as to what Trios Health is going through. Our situation is very different. Trios Health is not closing. Chapter 9 specifically provides for the reorganization of municipalities. Our district is a municipality by Washington law. This filing provides us the opportunity to propose a more optional plan for how to catch up and repay on our debt. It's important that our community understands these financial challenges did not just happen over the past few months. The clouds have been on the horizon for a number of years as the healthcare industry continues to go through radical changes. At the time that we constructed a much-needed new hospital and outpatient facility, we also realized mounting and aggressive local competition. As I said before, it was a perfect storm. While today's news may seem like a death sentence for Trios Health, let me assure you it is not. This is absolutely not. Relieving our leadership and staff of the daily pressures of our finances through Chapter 9 gives us some breathing room while our attorneys work on a debt restructuring plan through the court system. This is a beginning. Over the past several months, every doctor, nurse, technologist, and staff member here has had a laser focus. Focus on the reduction of expenses and focus on the reduction of our workforce to match our patient volumes, which our volumes continue to surpass the volumes of last year. This is very difficult work, and I commend all of their commitment. The time has not passed for us to fix our financial challenges, and we have every reason to be successful in doing so. As we turn things around, we ask that our community continue to turn to us for its healthcare needs. I can assure you that financial challenges do not translate into patient safety issues, service quality problems, or unnecessary price increases. In fact, as reported to us recently by one of the largest insurance carriers in the state of Washington, our attention to the quality of patient care leads in the Tri-Cities and is among the top in the state. It's not meant to brag or to draw conclusions. It's just a statement illustrating that despite the challenges we face, we are focusing on every patient, every time, and are delivering what this community needs. I emphasize this point once again. This Chapter 9 filing is not the end. It's a demonstration of our commitment. It is the beginning of a new chapter. Thank you very much.